All right, welcome back. Thank you for staying with us this far. We appreciate you for making time always to be with us right here on Good Morning Kenya. On Twitter, I see Christine Omondi tuned in. There's Michael M. So we also have Ham who's tuned in. Thank you so much. Prudence Wanza. As always, William Mwamburi tuned in from Watamu. We appreciate you for making time. Beth Njoroge, thank you so much for tuning in. Kamau Dirima, thank you so much for staying with us this far. Keep talking to us. We'd love to know where you're watching us from this morning. Check in on Twitter. Our official handle is at KBC Channel 1. The official hashtag is Good Morning Kenya, and my handle is at Jade Mboy. And you can also use our Facebook page at KBC Channel 1. You can find us on that platform. So we now want to switch gear, move from politics and go to matters concerning the family. And our conversation for today is all about cervical cancer. Now, January is known as the Cervical Cancer Awareness Month, and we are, you know, in the home run, the home stretch. And we're just trying to see where we are as a country when it comes to cervical cancer. Why is it still a problem in Kenya? You know, just looking at global stats, cervical cancer is the second leading form of cancer among women, coming in second, of course, after breast cancer. And just looking at the Kenyan cancer burden, let me just give you some stats as is, and this is information as recent as what was put out by the ministry. Kenya is among the top 20 countries globally that are dealing with the cervical cancer burden. When it comes to the screening nature, in Kenya it currently stands at 16%. Only 16% of women have ever been screened for cervical cancer. When it comes to the mortality rate, 9 women die on a daily here in Kenya, bringing to a total of about 5,200. When it comes to the diagnosis, it stands at 5,250, translating to 33 in every 100,000 Kenyans. And when it comes to the countries that have introduced the HPV vaccine, which has been a subject of quite heavy conversation, Kenya is among the countries, the few countries in Africa that have actually adopted this particular vaccine and have it as a free part of the free vaccines that are given in our country when it comes to the routine vaccines that are given to our children, and most of targeting children aged between 9 and 10. But where are we when it comes to this conversation about cervical cancer? We welcome you to share with us your thoughts, questions, clarifications, or anything really that you may be needing to share with us or address in regards to this conversation. And to help me with this conversation in studio this morning, we have Dr. John Macharia, who is a general physician working with Bliss Medical Center. Karibu sana, Daktari.
Asante sana.
Thank you for making time to be with us this morning.
You're welcome.
Now, when we talk about cervical cancer, for most women, they might understand what it really means. But for the benefit of our young viewers who could be watching us this morning and they don't really understand what cervical cancer is, when you talk about cervical cancer, maybe we could start there with the basics of what cervical cancer is.
Well, I would start with the anatomy. What is the cervix?
Yes.
Because we might just talk about cervical cancer and we've not gone to the basic to know what is this cancer.
Absolutely.
The cervix is part of the uterus, is the lower part of the uterus. Look at the uterus as a pot that is inverted or upside down. The mouth of that pot is where the cervix is. Basically, it's the lower part, lowermost part of the uterus, or the opening of the uterus, depending on how you look at it. So this cervical cancer is cancer affecting that part of the uterus, the cervix of the uterus.
Yes.
Yes.
Now, when it comes to information and awareness concerning cervical cancer, from what you have seen interacting with your patients on a daily and just the general information that you have encountered, how are we doing information and awareness of cervical cancer?
We are doing very poorly.
You're doing poorly?
I must say we are doing very poorly. You probably are in the urban center and you are aware about cervical cancer, but go to the rural areas. You'll find that those ladies don't know anything about cervical cancer at all. And that's actually one of the problems that we are having, because they might get it, they don't even know the symptoms of this cervical cancer. So they might be having them and they don't know that they need to go to a health facility. So they might think this is normal, this is basically routine, or it's just another day like just the previous day.
Yeah.
So information and awareness is very poor as far as cervical cancer is concerned in this country.
Yes, and this brings me to now this whole aspect of misconceptions that revolve around cervical cancer. And I want us to start with the age question, because most people think if you are not of the reproductive age, you are not susceptible to cervical cancer. But what really is or rather, at what age is one considered to be mature reproductively, and thus comes in the question of cervical cancer, predisposing factor looking at age?
Well, cervical cancer, chances of cervical cancer increase with age. But there's one thing you also note, that cervical cancer is caused by a virus, human papilloma virus, that is sexually transmitted. So what I'm saying is that if you're sexually active, then basically you're at risk of getting this cervical cancer. Number two, cervical cancer is not a very fast progressing disease. Before you get full-blown cervical cancer, it takes 10 to 15 years.
Wow.
So you might have gotten exposed at the age of 15 to the human papilloma virus. But by the time you're developing this cervical cancer is when you're 40 years old. So you cannot say that it's a disease for those ones who are above 50 or something.
Yeah.
Those people, if you get the cervical cancer at 50, most probably it started developing 15 years earlier, when you are 30s. So what I'm saying is that screening should be for the active, the sexually active.
So age is never really a question to narrow the conversation down to.
It's never a question.
It's mostly about the sexual activities that this person involves in.
Yes, and also the fact that the disease progresses over a long period of time.
Yeah.
So you see, if you cannot say that it gets people who are 50, but the person who got the cancer, who was detected the cancer at 50, this cancer developed 15 years earlier. So you see, if you get this cancer at 40, you're talking about developed from the time you're 25. So it took about 10 to 15 years earlier, which would have been detected that time.
Okay.
Yeah, so you really cannot say it for those old ladies, because I'm addressing especially the young ladies now who think, no, they cannot get. So long as they're sexually active,
that's always a risk factor.
It's a risk factor.
Now, looking at this time space we are in, we're coming from this COVID pandemic break, and you have seen the cases that have been reported when it comes to sexual assault. So many young girls have fallen pregnant at very young ages. Looking at these young girls now in this time space that they're in, most of them aged between 9 and 18 years, 15 years to come. Are we looking at a potential upsurge in the number of, or are the potential cases when it comes to cervical cancer if we don't actually try to address the situation now?
Yes, that's a possibility. That's a possibility, because it means these young girls have been exposed sexually, and they've been exposed to, by the bigger adults. So basically, and since cervical cancer is sexually transmitted, looking from that angle, then there is a possibility that you can have an upsurge. But on the other hand, we might not have. Ask me why. The reason being,
yes, it
doesn't mean that anytime you get exposed to human papilloma virus, you develop cervical cancer. There are some things we call cofactors. If one gets exposed to human papilloma virus, or rather human papilloma virus is not equal to cervical cancer.
Yes.
You can get exposed to human papilloma virus and you don't develop cervical cancer. Yeah, so there are those cofactors. There is the issue of immunity. Being a virus, there is the issue of immunity as well, how the body fights it off.
Yes.
So you can get exposed and the body fights it off. Okay? Then there are cofactors like smoking and other habits and depressed immunity. All these are cofactors that now can facilitate or can enhance the spread of, the development of this cervical cancer. Okay,
yes. And I want us to delve a bit deeper into that, looking at some of those predisposing factors. You call them cofactors that contribute to one potentially ending up with cervical cancer. And I want us to address them each individually. And let's start with drugs and alcohol. Most might not see the relationship, but from a medical stand, what is the relationship when it comes to some of these lifestyle conditions that we put upon ourselves, and also looking at drugs and alcohol and substance abuse in relation to cervical cancer?
Yeah, some of these drugs and alcohol depress the immunity. Yes. So the body cannot be able to fight effectively that virus that you might be exposed to. That's why it's called a cofactor. The other factors is that this lifestyle also brings other diseases like diabetes. Diabetes is known also to reduce immunity. So you see how it carries along, because you see now when you develop diabetes, your immunity is also depressed. Yeah. And you've seen it even with COVID. People with diabetes are at risk because the immunity is also reduced. So these factors also multiple sexual partners also. Yeah, that's a lifestyle. So you increase chances of contracting this HPV also.
Yes.
Yeah, so that's how lifestyle can also affect.
Can contribute to one being at high risk.
Yes.
And looking at genetic predisposition, is this something of concern?
Yes, there's research says that, but it's not very strong, that there's a genetic predisposition. Well, with almost all cancers, I mean, not most of the cancers, you see, like colonic cancer, the breast cancer, they have some genetic predisposition, but you discover there is more genetic predisposition in some cancers than others. For example, breast cancer, that one is known to have a lot of genetic predisposition.
Yeah.
Yeah. Colonic cancer is also known to have a lot of genetic predisposition, unlike the other cancers that really is not that much.
Okay.
Yes.
So in as much as it could be a factor, it's not one to raise as much concern.
Yeah.
Now, but for some of those, what are some of those symptoms that clearly point out towards cervical, to one being at risk or rather having cervical cancer? Because many a times when we're having some symptoms, we tend to relate them to other conditions, other hormonal issues. We always turn to hormonal imbalances, or my cycle, or this, but there could actually be symptoms that could be indicating to cervical cancer.
Yeah, there are those signs of what we call symptoms of cervical cancer. One is a foul-smelling discharge, and for obvious reason. The cervical cancer will cause inflammation and corrosion or erosion of the cervix. So this will produce some liquid that will be foul-smelling. So a foul-smelling discharge is a symptom.
Color, what the color of that particular discharge?
It's bloody.
Bloody.
Bloody discharge. Okay. Number two, and of course you don't mistake it with the usual discharge that you can have, yeast infection or rest, but it's up to you to go to the doctor to determine. Then we also have bleeding after intimacy, after intercourse. Yes, that bleeding and pain during intercourse. Okay. That can also be a sign of symptom of breast cancer.
Cervical cancer.
I mean cervical cancer, sorry. I think then we have low abdominal pain, what you call pelvic pain, is also a symptom of cervical cancer.
Okay.
Yes.
All right.
Yes.
Okay.
So the symptoms are vague.
Yeah.
Really, you cannot say that this symptom is equals to this. Yeah. So that is why screening plays a big role. It's important because the symptoms are not very specific. Because when you talk about a discharge, every other lady will have a discharge, maybe yeast infection or something. When you talk about bleeding, some people will have irregular periods, and you have bleeding in between your period or spotting for that matter. Even the contraceptives like the Depo-Provera, that is an injectable one. You get these ladies sometimes get spotting in between their cycles, or they don't get their cycles at all. But it comes as a spot, as spotting. You see, pelvic pain is also vague because people get what we call cramps during their period. So really, they are not very specific.
Yes.
Yes.
And that's why it brings so much concern when you think about it, because some of these symptoms, they clearly mimic other conditions that, you know, women get to experience when it comes to their reproductive health. There comes in the question of screening. What is screening to start with? Let's start with definition of some of these terminologies that we are using. Screening. Yeah. Tell us a bit about it.
Screening is, how do I put it? Screening is just a routine checkup. It's a routine checkup to check whether you have a certain disease or you don't have it. So screening is done just to, it's to investigate, it's to find out, it's a checkup, kind of. Yeah, just like you can go have your blood pressure checked, screening is part of it also.
All right.
Yes.
Now coming down to cervical cancer screening. Take us through the process. What does it entail? What is the screening test in itself called? Because we might know it, but we don't, you know, we are very good at throwing around terms.
Yes.
But when it comes to really understanding what we're talking about, that's a whole different conversation. So let us hear from you.
Yes, the basic screening test for cervical cancer is a Pap Smear, what you call Pap Smear. The full name is actually Papa Nikolai's smear, but it's a very long name.
Pap Smear too.
But we know Pap Smear, that is good enough.
Yeah.
A Pap Smear is a very basic test, very cheap and very, very fast. Because to do a Pap Smear takes about, to take the specimen, takes about a minute or so. The whole procedure to have a Pap Smear done is about 5 minutes. So what does it entail? It entails this lady going to visit the doctor, then the doctor accessing the cervix. There are some tools we use to open up the the reproductive organ so that we can see the cervix. Once we see the cervix, then we just take a swab. It's a swab. It's something like what you use as a cotton bud, and just take a swab of those cells. So you see there's no pain. It's not invasive. Then you put it on a slide, and you put a fixative. Then the pathologist looks at it.
Okay.
Yes.
You know, for most, at least for those who have gone for a Pap smear, we have had so many say that it's very invasive, and comes in the question of when during your cycle it needs to be done. Is there a specific time on your cycle that is conducive for the Pap smear to be done?
It should not be done when you're having your period, for obvious reasons, because when you're having your period, the blood is going to interfere with the cells, the visibility of the cells. You see, mind you, what we want to look at is cells, to see whether these are normal cervical cells or the abnormal cervical cells. But once they are mixed with blood, then you really cannot tell. So you should not have it when you're having your periods or you have any form of bleeding, because it's going to interfere with the result.
Okay.
Yes.
So definitely not when you're on your period?
Definitely not.
Should it be just before your menses or after your menses? When is it recommended?
Mid-cycle. Mid-cycle is recommended, yes. Between the two periods.
Okay.
Yes.
All right, so that's some guiding information for those who have been wondering when to best go for a Pap smear. Mid-cycle is considered to be the best time, definitely not when you are on your menses. Now, after you have taken this sample and you have the pathologist has taken it, done investigations, and cervical cancer cells are detected, what is the next step?
Now, when the cervical cells are detected, one, that's a good thing. Okay. Because at least you've known you have the disease. The next step is staging this disease. You want to see how advanced is it. Because there are the 4 stages, actually 5 stages of cancer of the cervix or cervical cancer. We have stage 0 to stage 4. Okay. Okay. Stage 0 being what we call carcinoma in situ. It just involves, it's microscopic, just the cells around there. That is 100% curable. Okay? So if you do a Pap smear and it's carcinoma in situ, even after staging, the staging now will involve, you want to see, because I need to explain what staging is. Yeah. So that we are in the same terms. Staging is how advanced the disease is. You want to see, is the disease confined to the cervix? Has the disease left the cervix to the vagina? That is the upper part of the vagina. That's a different stage. Has the disease left the cervix, gone to the lower part of the vagina? Has the disease left the uterus to the surrounding organs? We have the lymph nodes, and we have the bladder, and we have the large intestines. We have organs around the pelvis. Yes. Has the disease now left those organs and gone to distant organs like the liver and the lungs and the brain? Those are what we call distant metastasis. Now that is very late disease. That distant stage 4. Stage 3, it's still confined, but is involving the lower part of the vagina. So it's just the spread. That's how you stage. Okay. So the moment a Pap smear detects, then you want to stage. And this can be staged using different radiological, or rather, let me put in investigations. We have CT scan, we have MRI, yeah? We have biopsy, where you take a small tissue and confirm the disease and take it to the pathologist to check. All this will assist us in knowing what stage it is. And once we know what stage it is, then we are going to determine what management are we going to institute. Yes. The best for that particular stage. Yes. And for the benefit of our viewer, what are some of those treatment options that are available for the various stages? Just in general, just put them together for our viewers to know if so that someone is watching us this morning and they are on a certain treatment, just to be sure that they are actually on the right path. Yeah. For stage 0, which is carcinoma in situ, just involving the outermost layer, or rather the outermost layer of the cervix. Or rather, when you look at it from the inside, is the innermost layer, or rather the topmost layer. There's a treatment option where you can go and do surgery and just strip all those cells, and the patient is cured. Because you see, the disease has not even spread further. So you just go and make... It's still localized? Yeah, like a sleeve. Okay. And you get those tissues out. Okay? When you go to stage 1 and stage 2, what are we talking about? We are talking about the disease is still confined to the uterus. Or rather, the reproductive organ has not really broken bone. Surgery is the mainstay. Surgery is the mainstay in early, and that is called early cervical cancers. Up to stage 2 is early cervical cancer. So surgery is a mainstay. So you do what we call total hysterectomy. What I mean total hysterectomy is total removal of the womb.
The uterus, yeah.
Of the uterus or of the womb. So you do total hysterectomy where you remove the womb and the cervix completely. Now, depending on if you suspect whether the disease has gone to the lymph nodes or the surrounding organs, then you can combine it with a bit of chemotherapy or radiotherapy. But sometimes surgery alone is sufficient.
Okay.
Yes.
All right.
When it comes to now the late disease, now, stage 3 surgery might help, but you have to do something called adjuvant treatment. Adjuvant, I mean added on treatment. That is chemotherapy or radiotherapy.
Okay.
So for late disease, chemotherapy and radiotherapy go hand in hand with any other treatment that you are giving.
All right.
Yes.
So we do hope that is some guiding information in regards to the treatment you have either received before or are currently on if you are a patient when it comes to cervical cancer. But let's talk a bit about the HPV, the human papilloma virus that, causes cervical cancer. A while back, there was so much controversy about the vaccine, and especially looking at the age in which it is recommended. But from where you sit, looking at this particular virus and the vaccine, why is it important to actually get the vaccine before you are actually exposed?
Yeah, well, let me say that there's a lot of myth around the vaccine, and basically the myth can come due to misinformation, or not even misinformation, lack of information. Let's start from there. And of course, as Kenyans, we like spreading rumors without any facts, but when you ask actually what does it do, you really won't have any explanation. When you look at the vaccine, research has been done. I mean, countries that are way advanced than us are using it. Yeah, and they are vaccinating their girls even from 9 years old. Research has been shown that it has no even side effect if you give it to the infants. I mean, from 2 years, 3 years, it has no side effect. This is research that has been done. So there's nothing wrong with that vaccine. Number 2, why should we give it before one is sexually active? For obvious reason. Human papilloma virus is sexually transmitted. So, and a vaccine is preventive, is not curative.
Yes.
So you should be given before you get exposed. So that is the reason why you should get it before you're sexually active.
And when it comes to demystifying this myth about it predisposing our young girls to fertility issues, because that is one concern that is still a voice that is ringing still very loud among the population as to why they're having reservations about taking our young girls to get this vaccine.
I think we always say information is power. We just have to continue preaching this gospel of the same. Let's do it in schools. Let the girls take care of their health. Because you see, it's a girl's health, it's not the mother's health. So the mother might be protesting, but if the girl sees the reason why they should get this vaccine, then she's going to insist, no, I need to get this vaccine. So let us start by educating these girls. Because they know, they understand these things so that they know the importance of this. They'll even push their parents to make sure that they get the vaccine. Yes.
Now, when it comes to age, why is it recommended to be given between the age of 9 and 10 from a medical standing?
Well, it's just argued that that is a time basically between 9 and 10 you're not sexually active. Yes. The argument is because by that time you're not sexually active.
Okay.
Yes, it's not for any reason, because I told you, as I said earlier, research has shown that you can even give it earlier without any side effects.
Okay.
Yes.
So it's mostly a conversation that tilts towards sexual activity.
Yes, you see puberty.
Catching you before.
Before, yes, exactly.
Okay.
Yes.
Now comes in of how this vaccine is administered. Maybe you could take us through that process. Is it a one-time dose, or are there a number of doses that are involved, and how far apart are they done if there are a number of doses?
Yeah, I think it depends on the vaccine that you're getting.
Okay.
I think they've come up with, I'm not very sure about this, but they've come up with one that is just one shot, depending on the age you are in. Just one shot injection and you're covered for the rest of your life. Okay. Because initially also we had 2 shots where you could get one and then you get one 6 months apart or something. And so it just depends on the type of vaccine and the time you're being given. Your doctor should be able to tell you whether you'll need the one-shot one or you will need one and then 6 months down the line. Yes.
Okay. Yes. And then there's the issue of cost, because many people turn to saying that it's expensive.
Yes, it's not cheap.
Yes.
It's not cheap. It's not cheap, and that can be that's a hindrance, because the last I checked, I mean, a shot of was going for between 5,000 and 6,000, and that's quite some amount. So what would happen is that we should go full scale. The government should go full scale and have it like what we have the KEPI. The KEPI vaccines are these vaccines you give children when they are born.
Yes.
BCG against measles, against polio. When we are trying to kick polio out of Kenya, it should be part of that routine. It should be part of the vaccination schedule that the government should take up. Then that would ease the burden on the people. But one thing you also note that even the KEPI vaccine, some people still don't go for them. So bottom line is information, so that people know the importance of this vaccine. Because you see, most people will know that a child can get measles, can get mumps,
yes,
can get chicken pox. But cancer of the cervix is not there, because they are saying this is a child cannot get cancer. So let people know that this cancer begins early, and it is caused by a sexually transmitted virus that can be vaccinated against.
Okay.
Yes.
It's not a death sentence, because
definitely it's not.
There's also the mental burden that most people get to struggle with, because once they hear cancer at your birth, it's the end of life.
Absolutely, and that's why I staged it. That's why I staged it, and I said that early cervical cancer is 100% curable. So it's not a death sentence. Let people know it's not a death sentence. And even when you have it, let even the society know, even the family setup, give you the social support. We know when they have information, they will know you are not going the next day.
Yes.
Yeah, so they will know that you still can survive with this cancer.
Absolutely.
Yeah.
And when it comes to screening, how often is it recommended to have screening done?
Screening should be done yearly. Should be done yearly. After menopause, maybe you can postpone it to 2 yearly. But I mean after 2 years. But ideally, you should do it yearly.
And from
it doesn't cause any side effect. Yeah, it's not that uncomfortable. I mean, it's an office procedure. You can leave the studio after we are here. You go do a Pap Smear as I'm having a cup of coffee, and you'll have it done. And when I'm finishing with my cup of coffee, your Pap Smear is already done. So really, yeah.
And for young girls, as long as they're sexually active, their age doesn't matter?
No, it doesn't matter.
As long as you're sexually active, it doesn't matter how young you are.
Yes.
You are
at risk.
At risk.
Yes.
As long as you are sexually active, you need to understand that you are at risk. Ooh, my roots are showing today. You are at risk of getting cervical cancer. So again, issues to do with age. This conversation around age is one thing that has made so many parents very hesitant about taking their children to get screening. So if you know your child is sexually active, it would be recommended to not bury your head in the sand and presume they're not, while actually they are. Help be the first line of defense. Now, we welcome your questions in regards to this conversation. The hashtag is Good Morning Kenya on Twitter, at KBC Channel 1, and at Jane Wamboy is how you can send through your questions or comments or any clarifications that you may be needing. And there's Susan here who's asking, what is the potential of a recurrence of cervical cancer after a hysterectomy?
Well, after hysterectomy, what happens really cannot, the recurrence might not involve the cervix per se. The recurrence could be that the disease had spread to the lymph nodes or the surrounding organs that was not detected.
Yes.
Yes. So it had broken borders. Yes. That is the reason. That would cause a recurrence.
All right. So maybe,
or some tissues with during surgery, some tissues which had the cancer cells were left left intact. So those ones can continue spreading the disease.
All right. There's also Kulabi who is asking, I have a colleague who is expectant and just discovered she has cervical cancer. I think stage 1 or 2 just indicated the early stages. How can such a situation be handled?
Yes, okay. One, there are 2 things you'll have to look at. You look at the risk versus the benefit. The cervical cancer is a slow progressing disease. If it is detected and you have 1 month to deliver, logic dictates deliver, and then from there you start active management of the disease. Okay. Yes, because you see, 1 month down the line is not going to cause so much havoc. So there are so many. Now that is where you sit what we call panel of doctors and look at consideration, risk versus benefit. Okay? Because you don't want to go removing that uterus and she's going to deliver in 1 month.
Yeah.
Okay?
Okay.
Then you also don't want to go scraping that cervix because you might
put the baby at
initiate
risk.
labor.
Yeah.
Yeah, and the baby might not be mature enough to come out. You get what I mean? Because you've excited the cervix. It's the opening of the uterus. So you might initiate labor. So those you look at, every case has to be looked individually. And even that stage is quite early. So it's something that probably you can buy time and deliver the baby. Then immediately, she does not sit on a laurel. She has to come to the hospital and active management done.
Okay.
Yeah.
So this involves a lot of professional consultations. So you can direct your friend to just make sure she's in close contact and conversation with medical professionals. Different medics are going to be involved in this particular case because of the management of the pregnancy and the cancer as well. But we do wish you the absolute best. We do hope your friend gets their baby healthy and they do get the proper treatment. Christine is asking, are there different strains of the HPV virus?
Yes, there are different strains of what you call subtypes.
All leading to cancer or?
No, majority don't lead to cancer.
Okay.
Only a few subtypes. Actually, even the what you get what you get on your skin, on anywhere, is HPV. Is human papilloma virus, but a subtype that does not cause cancer of the cervix.
Okay.
Yes, it's only, there are about 2 or 3 subtypes that cause, it's actually 2 subtypes that cause cancer of the cervix.
Okay.
Yes.
All right.
Yes.
Information is power. You know, getting to understand what these are. All right. So Michael M. I believe this is Michael. Yes. Michael Mso is asking, are men at risk of contracting this HPV, and what are the consequences in men?
Yes, men are actually the ones who cause these problems because they are the ones who transmit it to the ladies.
Well, that was direct. Okay.
Yes, because it's sexually transmitted.
Yeah.
That's what happens that men don't get cancer of the cervix. For obvious reason, they don't have a cervix. So they don't
Wait,
get
so
cancer.
is the man the carrier or what?
The man is more of the carrier.
Okay.
Yes. But you see, he's a selfish person because he won't get the cervix, cervical cancer.
My seat.
Won't get the cervical cancer themselves because they don't have a cervix, but they'll transmit to somebody who will get cervical cancer.
So, does it affect them in any way, leading to any reproductive diseases, or it's harmless in most men?
It's more or less harmless. The only time it might appear like genital warts around the groin, basically. But basically, it doesn't have major symptoms.
All right.
Yeah.
It does not have major symptoms in men. I believe that answers your question, Michael. Thank you so much for sending them through. And we welcome also our gentlemen to send these questions. This is not just a conversation that is completely narrowed down to women. That was a question from a man, and we appreciate that. Asego is asking, this discharge, I'd like to know more about it because I'm trying to paraphrase this. When it comes to the discharge, how can you help even our gentlemen, help our ladies understand that this form of discharge might be of concern?
Yeah, okay, that's a very good question. Because as we said earlier during the program, we said that these symptoms are not specific. Yes, we need to know what different kinds of discharge in ladies. The commonest kind of discharge is what we call yeast discharge or candidiasis. What we call commonly, the layman will call it yeast. Yes, this one appears like, it's curd-like. Curd-like is like a bit of yogurt kind of one. Yes, it is, and has this, what we call a peculiar smell. We call it a sweet smell. Sweet smell. It's curd and it looks quite curd-like. Yeah, and you can actually, if you peel it from the external genitalia or the reproductive organ, it leaves a red raw area. A red raw area that is burning, and that is why they get very uncomfortable. That is yeast. Very common during pregnancy. Any woman will have got an yeast in their
at some point.
Some of them get the yeast after their period. Any pregnant, most of 99%, about 95% of pregnant women will have yeast at one time. And it's, the yeast, if I'm to explain a little bit,
yes.
it's nothing foreign. Yeast is normal fungus found in the reproductive region. Yeah, it's normally there. It's when there is and there are bacteria also, helpful bacteria there. There's yeast that is there also very helpful. And their work is to maintain the vagina, the reproductive organ, in an acidic form.
The environment.
To prevent the environment, to prevent harmful bacteria from coming to affect that part of the body. So it's protective. But when this balance is distorted, one can be distorted by reduced immunity, like in pregnancy. Pregnancy reduces the immunity. 2, antibiotics. Antibiotics, you'll take them for a throat infection, for another infection, but you know it's not specific. It will go and clear the good bacteria down there. So you have the yeast proliferating without any competition. So that is also another cause of that.
The imbalance that comes in.
The imbalance that comes in.
Okay.
So that if you describe the yeast, it tells you. Then there is another, the discharge. So that is the yeast discharge. There is another discharge, what we call vaginosis or trichomonas. That one smells like fish. It is fish smelling. Yeah, that is a protozoa called trichomonas. Yeah, so that is not like the one for the cancer. Yeah, but smells like fish. The other smells a sweety smell, and it's kind of like, this one is greenish in color. This that smells like fish is greenish in color.
Okay.
But the one for cervical cancer smells badly, like something that is
foul smelling.
Foul smell that is rotting.
Okay.
And then it is bloody.
Okay.
It's dirty, bloody like that. Yeah, so that is a difference.
All right.
Yes.
So I believe with that information, you are better able to help your partner understand these different forms of discharge and what could be a cause of concern when it comes to the risk of cervical cancer being present. Now, I want to bring in this conversation about contraception because there was a tweet that I had seen. I have lost it here. I'm going to be pulling out soon. But it was in line with contraception and more so looking at this new one, the herbal pill that is taken once a month. And that question was asking about how safe it is, looking at its potency and how it changes the reproductive cycle of a woman. One pill once a month. I don't know what information you could be having about it.
Yeah, I've heard of this herb from China. I don't know how it works, but from my experience is that I had a patient who was on it, and then they developed very severe hormonal imbalance. So they got very heavy bleeding without any pattern, and they were constantly having their periods. So I think I've had 2 cases of those ones. So really, I can't talk much about it, but I can say that I've seen the harm it can cause. Okay. Yes, because I've seen people who've developed very regular periods, very regular heavy periods.
As a result of this herbal pill?
As a result of that herbal pill.
All right, so...
Yes. So I don't know, maybe more research should be done to it, but personally I will not recommend it.
All right, and as we draw the conversation to a close, this is now where we seek your advice as a medic when it comes to, number one, looking at these family planning methods, because I believe it's part of, any conversation revolving around reproductive health. You could touch a bit about that when it comes to consultation before you decide, I want this, needing to understand the risks. And number 2, what we need to know when it comes to cervical cancer, the basics about information. Very briefly, we're almost out of time.
Yes, contraceptives, we have different forms of contraceptives, different form, with different effectiveness and different side effects. You need to visit your doctor to tell you which is the best contraceptive for you. There are those ones who have issues with hormones, so they cannot use them. There are those ones who have other side effects. They are prone to developing clots in their calf muscles, what we call deep venous thrombosis or DVT. Those ones, basically, hormone-based contraceptives are contraindicated. So there are those ones who cannot use these also barrier methods are indicated for that matter. Okay, there are those ones who are basically have multiple sexual partners. So something like a coli is not indicated because it can lead to infection because of different exposures. So basically this can only be determined by your doctor.
Okay.
Yeah.
So always consult a physician or your gynae specifically for this conversation.
Yes.
Now, in regards to this Cancer Awareness Month that we are in, what is the message you'd like women to take home about cervical cancer as we start the year?
As we start the year, cervical cancer is real. We start from there. Cervical cancer is not a death sentence. Cervical cancer, when gotten early, is 100% curable.
Yes.
Let us go for screening against cervical cancer. Let us encourage our young girls, the girl child, to go for the vaccine, the HPV vaccine. That way we are going to eradicate this menace called cervical cancer.
And there you have it, Cervical Cancer Awareness Month. It is the month we are in. As we draw it to a close, learn something about cervical cancer. Whether you're a gentleman or a lady, it doesn't hurt to know. Information is power at the end of the day. You could be the one who is passing on this information to somebody who did not know that they needed it. Get this information out there as the month continues to draw to a close. There is an initiative that was in this nationwide campaign that is coming to an end today. It has been running since the 19th of January when it comes to screening. So you can go to any of your county health facilities. You will be able to get services in regards to this. Just get screened. It doesn't hurt to know, you know? And if you get to discover that you are having some of these cells that are cancerous, treatment is always available. Again, this is not a death sentence. And if detected at an early stage, as Dr. has said, it is 100% curable. It is not a death sentence. And for each stage, there is a treatment option for that particular stage of cancer that you are in. So that brings us to a close of this conversation. We have just been looking at this conversation about cervical cancer, where we are as a country, and what more we need to do to just get to a space where cervical cancer is not the second leading cause of death among women after breast cancer. And helping us with this conversation, we have been speaking with Dr. John Macharia, who is a general physician working with Bliss Medical Center. Thank you so much, Dr. for making time. We appreciate it.
Thank you.
All right, so that's it from us right here on Good Morning Kenya. We appreciate you so much for always talking to us. Let me just send some love out to all those who have talked to us this morning. There's Elhaj Boka Lamine Sako, thank you so much. There is Women for Cancer, I can see you're retweeting the feedback. Mukembi Leviticus, thank you so much for tuning in. There's also Saadia Dida, thank you so much. Aros Asego, Athol Ken, thank you for tuning in and for always contributing to the conversation. Felix Mushukhani Kagali, thank you so much. Prudence Wanza, who else do I see here? Patrick Mbuzia. Thank you so much for being part of the family and for talking to us on Twitter. Remember to join us again tomorrow morning right here on Good Morning Kenya for another fantastic edition of Good Morning Kenya. My name is Jedwan Boy. Have a lovely day. God bless. See you tomorrow.